back to New Day Northwest. As many as 10% of women of reproductive age suffer from a disease that often has no symptoms at all but can stop them from becoming pregnant. It's called polycystic ovary syndrome. But the good news is it's completely treatable. Dr. Angela Thayer from Seattle Reproductive Medicine and her patient Heidi Jackson are here this morning to offer some help for PCOS. Dr. Thayer, what exactly is it?
So PCOS is a very common condition where a lot of women, the most common symptom is they don't menstruate regularly. They have irregular periods or even no periods. They might have excess face or body hair, or they might have acne or hair thinning on the top of their head.
But you'd think that was any number of things. You wouldn't necessarily connect that with a reproductive problem, right?
That's right. It can be other things as well, which is why it's important to make a diagnosis and get the treatment right.
And so do people often come in a little bit later in the trying phase of all of this because they don't know that this is a problem?
Sure. You know, when you're having menstrual cycles, even if they're irregular, you assume sometimes that you're still ovulating when in fact you might not be ovulating at all. And obviously if you're not releasing an egg, you're not going to get pregnant.
Right, yeah, that turns out to be important.
Yeah.
So let's take a look at a couple of pictures.
Okay.
A regular ovary, and shall we look at the regular ovary first? Normal?
Yep.
Okay.
So this is a regular ovary, and there are small little follicles you can see, and that's normal. There's a lot of space that doesn't have follicles, which each contain an egg. But then if you compare that to a polycystic ovary, it looks very different.
Let's take a look at the polycystic. Oh yeah, you can definitely see.
So the polycystic ovary, it's where there are a lot of follicles, usually around the periphery of the ovary, and women will start to form a follicle, but then it won't go all the way to actually release. So you get these kind of follicles containing eggs trapped around the periphery.
Right, can't get to where they need to go. Heidi, you had this happen. Did you have any symptoms at all?
Well, except for irregular periods, no. I had no idea.
So it wasn't until you just didn't get pregnant as you wished that you sought this out. When you got the diagnosis, what was the treatment?
Actually, medicine, and she gave me, prescribed a medicine for the insulin resistance, and then also to stimulate ovulation.
Is that the normal course?
That can be, yeah. The normal course is to treat the insulin resistance that's associated with PCOS. So another thing is a lot of women with PCOS also find it easier to gain weight and harder to lose the weight because they've got more insulin resistance occurring, which can also interfere with ovulation. And then obviously they sometimes need ovulation medication to help push things along.
And is weight control easier after you've controlled these other things?
Well, so the treatment for insulin resistance, the best treatment we have is diet and exercise, really, you know, going on with healthy diet and daily exercise, which lowers insulin resistance for 24 hours. We know that's absolutely the best. And secondarily to that are medications like metformin, which can also help with the insulin resistance. It's never easy. I don't think the weight control ever becomes easy, but it becomes more manageable and huge progress can be seen.
Right. Well, in fact, there was huge progress for Heidi because Ken and her two little children, their two little children, are out in our audience. Hi there. And I love this. Their names are Max and Maud. Is that the cutest ever? I was going to say you got the easy part today out in the audience, but
not really.
But you're wrangling.
Yeah.
So what's it like when you've had a problem like this and finally there is success? You've got your family.
It's heartwarming, obviously. It's the best thing that's ever happened.
Yeah, it is pretty cool, isn't it? They look like those are keepers there.
They're keepers.
Heidi, I know it's super frustrating to go through something like this. So when you finally got to the end of the treatment and it was successful, would you encourage other women to really investigate and see what's going on if you have a problem?
Yeah, I mean, it is very treatable, and it's very encouraging that there's something so easy that can fix a problem, and so it's very non-invasive. And I would say if you think there's anything off, just go get checked out.
Go and get checked. 10% of women, Dr. Thayer, that's a lot of people.
It's a lot of people. And what we find is with the diet and exercise and the drugs together, we can get usually a really high percentage of women pregnant.
Is there any known cause for this? Any reason why this would happen?
We don't really know the cause. No, the root cause, it's just some kind of miscommunication that occurs having to do with the higher testosterone and having to do with the higher insulin. that really just doesn't allow that normal ovulation process to
So
occur.
nothing we could do to prevent it as we're growing up or as we're taking care of ourselves, other than perhaps trying to stay in reasonably good shape with diet and exercise.
That's right. As some women improve, just eat healthy. I mean, really, and it doesn't necessarily need to lead to weight loss, but just being healthier daily, some women will go back to an ovulatory pattern.
It's amazing to me, you know, we all grow up thinking getting pregnant is like falling off a log, and then when you have a problem, it's a big deal and sometimes takes a long time. But when you get a good result like this, and I'd say that's a pretty good result, then it's pretty happy stuff. That must be nice for you.
Yeah.
Heidi, congratulations. Max and Maude, so happy you're here.
Hi.
Hi. How you doing? That's what you get at the end of the rainbow. Thank you all so much. If you'd like to meet with a doctor at Seattle Reproductive Medicine or you'd like to learn more about PCOS, please visit our website at king5.com/newday. We'll be right back.